But I am a firm believer in the people. If given the truth, they can be depended upon to meet any national crises. The great point is to bring them the real facts. So this quote has been attributed to Abraham Lincoln, but maybe it was from General Douglas MacArthur. Whoever said it, I think the words ring true. The purpose of these daily press briefings is to bring you the real facts so that we can all respond appropriately to the crisis at hand. As Mayor Lightfoot, as Governor Pritzker has said, we all have a role to play. We see people stepping up in big and small ways, but everything matters. We are so interconnected that everybody's action, as well as their inaction, can play a positive or a negative effect on the community that we live in. The truth is, the number of cases will continue to increase, unfortunately, as will the deaths. The cases that I report do not capture all of the people in Illinois with COVID-19. Many of you know that you may have been ill but didn't have a test to confirm it. We know that we're not testing everyone. But I am reporting that there are 461 new cases and unfortunately 8 additional deaths. That brings our total in Illinois to 5,057 cases and a sobering 73 total deaths. We've also seen in the count the death of an individual from the Statesville Correctional Center. There are 12 men who were incarcerated at Stateville who are now hospitalized, several requiring ICU and ventilator support. There are 77 additional individuals who have symptoms who are being isolated within the facility. We also know of 11 staff who have symptoms and are being appropriately isolated. Congregate settings, such as Stateville, any other correctional center, pose unique challenges in stopping the spread of disease and protecting the health of individuals who live and work there. Those who are incarcerated obviously live and work and eat and study and recreate all within that same environment, heightening the potential for COVID-19 to spread really quickly once it's introduced. The options for isolation of COVID-19 cases are limited in this focused setting, and it becomes very difficult depending on the size of the facility and the population that's already in the facility. Ideally, all cases should be isolated individually and close contacts should be quarantined individually. I know our partners at the Department of Corrections are working innovatively to try to create the best situations for these facilities. But some correctional facilities and detention centers do not have enough individual cells. And so we are considering isolating multiple laboratory-confirmed COVID-19 cases together as a group, or quarantining close contacts of a particular case together as a group. Additionally, incarcerated individuals may have medical conditions that further increase their risk of disease from the COVID-19. We do know that Statesville has an older population of incarcerated individuals, so they are at greater risk of experiencing severe illness. Our focus right now is ensuring that these incarcerated individuals receive the appropriate medical care that they deserve and need. Public health officials are working with the medical staff and physicians who work in the correctional facilities on isolation and quarantine guidance, as well as healthcare triage. Incarcerated individuals who show symptoms are being tested for COVID-19. The Illinois Department of Corrections is taking a number of steps to control the spread of COVID-19 in its correctional centers. Staff who work with the individuals in isolation and quarantine, as well as in the health center, are wearing protective equipment. Staff are also having their temperature checked daily as they present to work each shift. Correctional centers with a confirmed case are placed on lockdown, which means that there will be no movement around the facility except for medical care. Other congregate type settings are also experiencing clusters of cases. Of course, nursing homes, which we have talked about numerous times, assisted livings, and other long-term care facilities across the state, including those in Evanston, Joliet, Taylorville, and Belleville, have all seen clusters of cases. Public health officials continue to provide guidance and assistance on infection control practices, resident monitoring, isolation, and quarantine. While our response to the coronavirus pandemic has been aggressive and robust, we must all continue to do what science has told us works: social distancing, washing our hands, staying home. Please continue to stay home as much as possible. We have to all do our part to end this pandemic.